Hey everyone, it's your boy KP here from the No Justice, No Peace report. Hope everything is all right with you. Remember to subscribe, and like and share. All right, I'm going to share a clip with you. It's an interview coming out of Australia, and it's of a man whose wife was infected with COVID and also of a doctor. Take a listen to it. They're highlighting a drug called a wonder drug, they call it, called Ivermectin.
Now, there are a lot of people in the media who are a bit paranoid about discussing coronavirus treatments. Perhaps they're scared off by Donald Trump constantly proclaiming game changers. But without a vaccine and with the pandemic continuing indefinitely, of course, treatments are all we have at the moment. Obviously, they're crucial and they're still evolving. One we brought to your attention some weeks back is the triple therapy promoted by Professor Thomas Borody in Sydney involving zinc, the common antibiotic dioxycycline, and of course ivermectin, which is a common antiparasitic drug. Now, studies at Monash University have shown that ivermectin does kill the virus in test tube settings, but the questions are about dosages and effectiveness in people in clinical use. At least 2 doctors have trialled this treatment in Melbourne, and we've been updated on progress with one family hit by COVID-19. Let's go to Michael Vudovic now, who joins us from Noble Park, a suburb in southeastern Melbourne. He's been diagnosed positive with coronavirus. Thanks for joining us, Michael. Tell us first up how you're feeling.
Thanks, Chris. I feel fantastic, actually. I've been on the 3. Obviously, we'll be talking a bit later about the 3 different the drugs that actually helped a lot, more so my wife. But right now, I'm feeling, quite normal. Other than I think I've lost my sense of smell. Other than that, I don't have any other problems.
Well, let's talk about your treatment and what's gone on here. You mentioned your wife and yourself. Tell us how long you've had the virus, how sick both of you have been.
Okay, my wife was the first one to contract the virus on the 29th of September. She immediately got very, very sick. She has other underlying problems. She's had to fight 3 cancer battles and a whole lot of other, very severe, medical problems. And it attacked her very quickly and had a lot of problems. But my wife has done a lot of research prior to this to actually find something for corona or for COVID, because her my mother-in-law contracted the coronavirus at St. Basil's. So we were actually looking for, what was out there. And the world says, Australia says there's nothing out there, but there's a lot of proof. There's a lot of, studies in places like Toronto, a nursing home. There's a lot of studies that, this stuff works. It saves people. It's proven, because the minute I gave it to my wife, Peter Lewis, we spoke about it. He prescribed it to us, and the minute I gave it to her, the improvement was amazing.
There's a lot of discussion about treatments now. Of course, we've heard that through the President as well. But just tell us firstly, your mother-in-law, did she survive at St. Basil's?
Yes, she did. A lot of the people at St. Basil's, 44 people the last count I had passed away.
Tell us what happens. You're diagnosed with coronavirus, the 2 of you. You isolate at home and your treatment is left up to you. Then you go to your own local doctor, your choice?
Well, we did. I phoned Peter Lewis. Peter's been my doctor for over 30-something years now, and our family doctor. And I phoned him because, people say there's no cure, but there is this medication. I saw one of your reports previously with Professor
Dr. Thomas Borody, yes.
Thomas Borody. And there's been other studies, Toronto study in a nursing home where a particular floor, a particular level were treated with the same stuff for a different illness altogether. And that entire floor did not get corona, did not get COVID. All the residents didn't get COVID. Only the nurses got COVID who weren't treated with. So that's an amazing, just amazing when you've got people in dementia wards, a whole level of people that did not get the virus, but all the nurses did.
Well, there's a lot of anecdotal evidence and there's a lot of studies underway, a lot of trials underway. Let's talk to you, Dr. Peter Lewis, who can join us now. Thanks for joining us, Peter. I wonder if you can tell us then about this triple treatment. We've heard about it from Professor Thomas Borody. Tell us what's involved and how certain you were about using this as a coronavirus treatment.
Yeah, sure. Well, I've been interested in ivermectin as a treatment for COVID for some time because I do quite a bit of work in Bangladesh. I have a couple of clinics where I teach over there. And a lot of the work on ivermectin has been done in Bangladesh. There have been 2 published studies that support ivermectin being effective as a treatment. And in fact, at this moment, as we speak, the head of my clinic in Bangladesh is suffering from COVID and is taking ivermectin himself. So the treatment usually involves zinc, doxycycline, and ivermectin in combination. And because of the anecdotal information from the doctors in Bangladesh that they're getting good results, and because of the published studies, I was fairly comfortable when Michael contacted me and said that he liked the idea of him and his family taking ivermectin. I thought that was a safe option.
Tell us, Doctor, then, what's the legal status for you prescribing these drugs for this condition? We know there's a lot of conjecture about various treatments around the world. What's the status of this treatment?
Well, my understanding it's called an off-label prescription. So ivermectin is readily available for parasite infections. It's not approved as a COVID infection treatment yet, but it can be used off-label.
Right, and what's your assessment? You've seen Michael, you've seen his wife. What's your assessment of their infections and how this treatment has worked on them?
Well, their feedback to me, particularly Angela, who was really quite sick at the start, their feedback is that they feel that they've improved at the same time that they were taking the ivermectin. So it's plausible that the ivermectin has helped.
Well, let's get the final word from each of you. Firstly, you, Michael, you are convinced that this treatment has helped you. You would suggest that more doctors need to look at it?
I think everybody has to look at it because what's our alternative? No medication, no treatment, just sit there and suffer at home.
And Dr. Peter Lewis, your advice about what should happen here? Should there be more studies? Should more doctors around Australia look at this treatment? What feedback are you getting and proposing?
Yes, we don't have to reinvent the wheel, though. A lot of this research is going on overseas. And I think because the viral load is so much higher in countries like Bangladesh and Brazil, the data is going to come from those countries first. We just don't have enough cases in Australia to be able to do much research here. We'll have to follow the expert advice from overseas on this. Well,
thanks for joining us, Dr. Lewis. I appreciate it. And also, Michael, to you and your family, all the best.
Thank you.
Thank you.
Fascinating stuff. We'll continue to monitor these sorts of treatments, the studies, the debate and the medical views. But obviously, if you're sick or worried about being infected, go to your doctor, seek your doctor's advice.
So, as you can see, the family experienced some wonderful benefits from using ivermectin, and the doctor mentioned or spoke a little bit about, its use not just in Australia, but other parts of the world. Ivermectin is not a new drug. It is cheap. It is something that doctors prescribe. I think you might be able to get it over the counter as well. They call it the wonder drug from Japan. The wonder drug from Japan. And it's been used. I have to be careful in terms of what I say on here because I don't want YouTube to flag my stuff or to take it down because I'm spreading misinformation. Check the description box. I'm gonna South Africa is approving ivermectin. Romania, ivermectin. It's been used in Bangladesh. I think I said that already. And the doctor also said this. I'm gonna drop a report from the Lancet, and if there's any other source, check them, right? And you'll notice what the Lancet is saying about ivermectin. They're not pushing it, but they're not downplaying it because it's something that's been used in order to deal with our current situation, all right, by many doctors. All right, that's what it is for now. Whatever else I find, I'll consistently share it with you. Thanks for the support. Thanks for subscribing. Hit the notification bell so you know when I've posted something. All right, if you appreciate it, man, subscribe. Stay woke and stay red.